think I'm the only one that didn't get the. Thank you. Okay, so
Thank you. I think this is
I
me,
think the first
Monica.
order of business is the consent agenda.
Yeah, for the, is there, entertain a motion for the consent agenda consisting of the meeting minutes from the prior December 15th, 2022 meeting? Is there a motion?
Motion.
Motion, is there a second? Second. All those in favor, please say aye.
Aye.
Motion carries. Moving on to the irregular agenda, we have a request to approve the annual report of the Fishers Health Department. I believe Monica shared this electronically earlier today.
Yes.
Earlier today. I did actually read it, today, and, appreciate all the good information in there. Is there anything you want to summarize?
Yeah, I have, just a couple of summary things, and I have a summary packet here, just so that you guys have an update on what's happened since the last meeting as well, as far as the first quarter. The summary on what happened since the first quarter is that we have, reinstated COVID-19 LabCorp, so you guys should contact with LabCorp, we haven't started testing. We've only had a handful of people come through, but we haven't well publicized it, but it is on the state website as far as the state, testing locations, and right now we're not taking payment for it. We're using COVID supplemental funding, from the state, to fund that as we kind of assess demand and make sure that our processes with LabCorp are working. We have started health inspections with a grading scale, so that is new as well. You can see here, that we've done 139 inspections so far, and had 7 Bs and 4 Cs, all the rest were As. We also have had our lead, one of our health inspectors has been certified, to do lead risk assessment, which will be helpful with the new lead guidelines. Even though we don't have a lot of lead in Fishers, we are having more than we did, so it's helpful to have that, certification on staff. We are still in planning with the Teen Health Academy. We hope to have the applications posted by the end, by the end of spring break. So we're just finalizing that, application process. Our health educator will start with us full time at the end of the school year because she is coming from HSC schools. But she has started part-time and is working on the curriculum for the Health Academy and some of our outreach activities over the summer. So we're very excited to have her, already working on those things. And I just had a meeting with her about an hour and a half ago. We also, yeah, go ahead.
I'm just curious. I'm just curious, what has the feedback been so far on the new grading system?
It's been pretty light, but we had done a lot of heavy talking about it beforehand. We had several public meetings, and webinars, and all of our inspectors have been talking about it for months and months. So there were no surprises. We haven't had a lot of pushback within the Cs. It's been pretty standard. We're not grading them on anything different than is already in the code. It's just that they'll get a grade. I think it'll come home a little bit more in September when we actually post it on their door front. But so far, it's been pretty smooth. So, on the next page, the social worker, we hired through the grant fund for the community paramedicine grant. She's starting April 10th, so I'm pretty excited about that coming up. So right after spring break, so it's really coming up soon. Also, at the last meeting, you guys approved Incredible Mind implementation. So this is a screenshot of our website, and we are looking to make that live. Well, it's live now. You can actually check it out. But to have our resources finalized, because we have to build out the community resources and do a big community push May 1st. And they provide us with a couple of weeks of Google ads to promote that. As well as we'll run a promo that the company includes in that onboarding for, like, if you take an assessment, then you'll be entered in a chance to win a $100 gift card or something. So we'll be promoting it in conjunction with Mental Health Month, which is the month of May, and Hope for Happiness event, which we coordinate with the kids at the schools. They put on that event at the farmers market, so that coincides with all of that timing. We also have really kicked off our mental health action teams, and those are getting into gear. And then I believe we have a culture of health ambassador position that we're hoping to post soon. That will be kind of a joint position between health and parks to really work on kind of broader programming that promotes health and wellness. So just going through the annual report, I know I sent you guys the full annual report draft, and again, it is in draft form, and if you want to see what it'll look like when it's pretty, you can look at the other 2 years that I referenced. I think that the content, as I put it in here, is not likely to change much. We still have a few grammar checks and things to do. The numbers, the communicable disease numbers, I think are pretty steady. I've highlighted on the table for you just the main commit change, which is the latent TB infections. We've seen a big increase this past year. Everybody's seen that. We think it's probably just because of people getting medical care again and getting those screenings. So nothing different about the population. We're seeing lots of Ukrainians and Venezuelans in our clinic needing the testing for immigration purposes, but the people who are, that were getting for latent TB are all across the board. And it's kind of the usual demographics that we typically see for that. So, everything else was pretty much the same as last year. As far as the numbers go, the annual report also includes the number of permits, inspections, vital records, health education activities that we did, and how many people, that we served with those. So those numbers are pretty consistent. I think there is a slight change on this, presentation from the draft that I sent out last night. It's just like we've been working to kind of tighten up some of those inspection numbers, so, we were able to find a reporting glitch and, found that we had indeed done lots of pool inspections. The annual report draft that I sent out had a lower number that was questionable, so. Let's see. And then the part of the, report that is required to be included for the state code is the revenue and expense category. So I've included that here for you, and, also is in the draft of the annual report. That's, straight from our controller's office. You can see that we do have a large, number of different grants of wildly varying amounts. The largest number that we see in the 2022 section is just the vaccine administration fees, and that's a contract that we have with the state Department of Health, where it, where they submit the billing on our behalf to the insurance companies, and whatever they're able to recapture, they pay to us. Obviously, since we did so many vaccines, over 120,000 vaccines, our payback is, fairly decent. We get, I think, $750 per shot if we recover that billing. So we work very hard to try to make sure to capture any instance that anybody does have, and don't send anybody away, so that we can recover that for, the city. Questions about you? I think that's the basics of it.
Any questions in general on the annual report? Seeing none, is there a motion to approve the annual report and submit to the state? Motion. A motion, is there a second? Second, all those in favor, please say aye.
Aye.
Carries. And then are we adjourning or just moving on to a retreat? Chris? Adjourn, all right. Is there a motion to adjourn the meeting, seeing no other new business?
Motion to adjourn.
Motion to adjourn, is there a second?
Second.
All those in favor, please say aye.
Aye.
Meeting adjourned. All right, Monica.
Hold on, just like, getting in there, yep. I'm gonna end it.
So it's still publicly.
Door's still open.
You're good, just end it right.